Welcome to another educational podcast. My name is Sharon Cruz.
And my name is Shiva.
Welcome Sharon and welcome Shiva. Today we are going to talk about pre and post fall management and also the use of a hoverjack. We do our best to try and prevent patients from falling. Are there anything that we can help do that?
When our patients come into hospital and are admitted, we complete a falls risk assessment. Ideally, this should be completed within 6 hours of the patient's admission. It will give us a good idea of their mobility and any equipment they need. We do need to do a bed rails assessment to define whether bed rails are recommended or needed.
Sometimes patients do have accidents and they fall. So how do we then manage a patient when we find that they have had a fall?
In day-to-day life, we'll get a live example of our patients that are in the wards. So one of my patients, we can see she is alert and oriented, has all her cognitions intact, and she is self-carrying independent and uses is mobile with the frame. And when she was trying to get out of the bed, trying to go use a toilet, she had a fall. We didn't know how she had a fall, so we can consider it as an unwitnessed fall. But we only came to know when she was trying to call for help. We heard the sound, we went there and had a look. So before I could assess the patient, I made sure all the dangerous objectives were removed out of the space, like the bed, IV stand, or the bins that are very close around the patients. Once I've moved that, I've called for help from my colleagues and so I'm going to ask you for help, if that's okay, to assess my patient.
So I'm working with Shiva and she's called for help. So on my way to the bay, I'm taking the blood pressure machine so that we can do some vital signs, and I'm also taking the blood glucose monitor so we can do a sugar level, and I'll go into the bay and help Shiva do initial assessments on our patient.
So once Sharon comes to help me with the vital signs and blood sugar monitoring, we ask one of the other colleague of ours to put out a call for the doctor's escalation and to security to get us the hoverjack. So to get the patient back in the bed, we usually use hoverjack. Can you help us with the information where we can find it and how we can get it to a unit?
Yes, so we have two hoverjacks, and they're situated outside Charlie Ward. We can ring the security team, tell them our location and our bed bay, and they can bring the hoverjacks to us for use.
So we've got the patient back in bed. Are there any administrative processes that we need to carry out?
So we will ask the patient if they're in any pain, and if so, if they require any analgesia. Ideally, this should be administered within 30 minutes of the incident. If they don't require, or they decline, or they don't need anything, it's also really useful to put patient refused on the drug chart, which is on our Excel.
So Shiva, what about the nurse's role in documentation?
So nurse's role in documentation, we obviously put in vital signs here, neuro-ops, but we also have to initiate a post-fall assessment and a post-fall care plan for the patient, Alex Health. And the most important part is we have to date exit, so the falls team is aware of it and they can come and review the patient.
Okay. So, and Sharon, how does the falls team help with this situation?
So I will go and review the patient, make sure that there's any equipment that should be used to minimise any further risk, which is our yellow bank falls blanket, non-slip socks. I'll also ask the team if they've made any physio referrals, risk assessments, whether we can use a low rise bed. However, we mustn't use bed rails with a low rise bed because it just puts more height. So if the patient is going to fall again, we've just raised it high.
So this patient that we have who's just recently had a fall, are there any particular observations that we need to carry out post-fall?
So we do neuro observations. So we initiate with an hourly neuro observation, then we proceed after 24 hours to 4-hourly neuro observation and 6-hourly and 24-hourly. That's how we proceed on. So it depends on the doctor what kind of neuro observations they want on the basis of the diagnostic tests that they have requested. Apart from just neuro-obs, we do lying and standing within the 24 hours of the patient in the unit. And if we are moving the patient to other unit, what do you suggest? How should we go ahead with it?
So a line and standing blood pressure should be done on admission. However, that's not always possible if they've come in with an injury. Some of our patients are confused. So if they're moved to another unit, the ward in there would be expected to do a line and standing blood pressure also. Then we would continue with that weekly unless the patient's condition or mobility or a fall has occurred. Then we would expect a line and standing blood pressure post that, escalating any postural hypertension to the medical team. Usually, if a fall is during the day, I would notify the next of kin immediately. If the fall is overnight and there's no harm or minor harm, for example a skin tear, a small skin tear, I would ask the day team who takes over to notify the next of kin. This also needs to be documented in the notes that they've been informed.
Shiva, how would you alert the rest of your team that this patient had a fall?
So when a patient has a fall, it is our duty to have all our team members informed by mentioning it in our safety huddles. We do raise detects, so it is going ahead for a proper investigation of the fall or what extra support that we need. Also, if I need more support, I usually reach out to my manager to reach out to falls team to guide us with more care and more procedures that is helpful for us. Or if one of my team needs more training, on hands-on training on Hoverjack use.
We can also escalate any concerns we have with our patients' mobility or risk of falls to our matrons who come round daily. They will take it to the staffing meeting. We have an enhanced care team now in the hospital who can provide one-to-one care if it's deemed that the patients need that. When a fall's reported by the ward teams, the datex will come straight through to myself, the falls nurse, so that I'm aware of it in good time, so that I can review these patients, support the staff if any support's needed, and also support the patient. So I work quite closely with the physio team, and we meet on a regular basis. The teams on the ward, the patient may still well be having physio and not discharged. However, if the patient has been discharged and they do have a fall once they've been discharged from physio, we do need to let the physio team know, because it may mean that they need to be re-referred for assessment.
I think we have used the community physios quite often once the patient goes home. So it's not just an end of care during the admission.
But they'll only be used if the physio team are aware that they need them because they've had a fall post-discharge.
Help! Help!
Sharon, you okay?
Yeah, I fell while using the frame.
Did you hit yourself? Did you hit your
I
head?
didn't hit my head. I'm
Are
just
you-
feeling a bit shaky. I don't think I'll be able to get up by myself.
Do you have any pain anywhere?
No, not right now.
So I'm just going to get some help to get you back in the bed, okay?
Okay.
So we've completed the general assessment of checking the vital signs and the BM levels as well as the neuro-obs. We are going to get the patient back in the bed using an equipment called Hoverjack, which will be delivered to us by the security when we did the escalation. So I'm going to use the sliding sheet. If you can help me turn her on her right side, we can put this back in the bed. Could you tell me this to the side, please? On your back. Let's get your legs on there. Sharon, will you be able to do a little shuffle for me?
Yes.
Would you can shuffle towards me. One more shuffle and we'll be in the center. Okay. Let's get your legs this side. Okay. If you both can grab the handles, we will move out of the way so we can position the Hoverjack. Sharon, we've got you on the mattress. It's going to be a little bit noisy and you're going to feel yourself lifted up from the floor. Don't be scared of it. It's just going to be air that is lifting the mattress up.
Okay.
Okay? So I'm going to connect you to the air inflator. You ready? Are you feeling okay, Sharon?
Yes, yes.
So I'm going to inflate the hover mattress, but before that I'm going to get the bed next to you. You're going to make sure all the brakes are locked before we move the patient to the bed. So the hover mattress has valves to it. They are black in colors, but keep in mind before you inflate the mattress, do not touch the red valves, but make sure they are properly locked because these are the vent out valves. And then we are going to start from the bottom valve and we are going to go all the way up. I'm going to re-inflate the mattress, then the one that we got you on from the floor, okay?
Yes.
So we are going to move you on the bed now. Sharon, I'm going to remove the sheet from under you. So we are going to have a couple of turns. So first you turn towards me and then we are going to turn you again to the opposite side. Is that okay?
Yes.
Okay. So ready to turn?
Yes.
Turn towards me, start folding like we fold the sheet. So put the legs of the sheet. Are you ready for your second turn?
Yes.
Okay. On the other side. This one. On your back. Then you can lift your head up for me. Is that better?
Yes, thank you.
After the patient use of the Hoverjack, we are going to clean the mattress and deflate the mattress and put it back in the trolley. We are also going to send an alert for a call to the security team to take the Hoverjack back in front of Charlie and make sure you ask them to plug the machine back in for charging.
We can just use plain nail wipes, making sure that we also use a good wipe to the strap.
Before we fold the mattress, make sure all the air is deflated from the side sheet. And then fold it in half. And then start folding. And then we deflate the hover mattress. So it's the red valves that you have to open for the air to come out completely. So we have opened the red valves of the hover mattress and we are going to fold it in half. So any air that is left in the mattress will be easily out. So we are going to start folding it. We'll push out all the air that is left in the mattress. Once all the air is out, make sure you revalve all the red bits. So it will be ready for use for the next patient. Thank you for watching this podcast, but look out for another educational podcast.
If you have any queries or need any support or advice, you can find me on Alertive, Sharon Cruz, Falls Nurse, and Sharon Cruz on an email. Thank you.
Thank you.